have a simple ECG. Now, before you jump into, understanding what it shows or what exactly it is or anything, just relax, take a breath, and let's go through the basics. So on screen you have a 12 kg ECG. You can tell that this is a 25mm box, and each box represents 0.2 milliseconds. So each little box represents 0.04. Now let's start off by identifying the different types of leads. So we have the limb leads, so leads 1, 2 and 3, VR, AVR, AVL and AVF, and then we have the precordial chest leads. So look at the ECG from a very far angle. So if you move or you get away from the ECG paper, you hold it away from your eye and you look for any abnormalities. Do you see any abnormalities? If not, no worries, because some people might not be able to get it in the first go, some people might be able to get it straight away, but it all depends on how well you know your normal ECGs, which is what tomorrow's lesson or the next series of the video is going to be about. So from here, let's follow our simple rule. We start off with our mnemonic RRPWQST. So the first one is rate. So what is the rate measured in beats per minute? Remember I told you that you can do this by simply looking at the RR interval. So here we can tell that there's 0.5 big boxes and there's one whole big box and another two. So almost there's two big boxes and roughly 2.5. So there's 2.5. So we know from our previous slides that this is roughly around 150, is between 150 to 100. So if you go back, remember, it goes down in so it's 2.5, so it's roughly between 150 to 100. So this patient is clearly tachycardic. Another way we can do this is we can measure the Qrs complex. So I know the screen, the ECG is very zoomed out and blurry to you guys, but in this case there is there is only two small boxes between the Qrs complex. Usually it's meant to be 3, so it's even shorter than 120 milliseconds, i.e. very less than 0.12, which means this heart is really firing fast. So again, suggestive of tachycardic. Now let's look at the rhythm. What's the next point? Rhythm is constant. So we have 2.5 boxes here, 2.5 boxes here, 2.5 boxes here between the RR. Remember, the rhythm is the number of squares or small boxes between each QRS complex. Here is also regular. This is 2, you roughly say 2.5, 2.5. Randomly take a lead in V4. We have 2, 2.5. Again, 2, 2.5. Yep. So you can definitely say it's a regular rhythm. Now, whether it's sinus is dependent on whether you can see a P wave. So you can somehow see a P wave just before every QRS complex in lead 1. You can see in lead 2. You can roughly just about see in lead 3. How about the augmented leads? Remember, AVR is always negative reciprocal, and in AVL you would always see an increased or more negative deflection in the S wave compared to the R wave. You can clearly see a P wave here. So you can safely say that this shows a sinus rhythm as well. Now, is there one P wave before every QRS complex? Yes, there is. So there is no worry that the patient is undergoing atrial fibrillation or some sort of heart block or anything. What about the Qrs complex? The Qrs complex we've identified as very little, as in it's even less than 0.12, i.e. 120 milliseconds, which was normally it's 3 small square boxes. In our case, only 2. So this patient is tachycardic. There is really rapid firing. Now, when the Qrs complex boxes are small, this can represent ischemia or some sort of heart failure, because the heart is trying to pump out as much blood to the ischemic area within the heart or into another different body part. The patient might be hypoxic, various different regions, but overall, that there is some sort of tachycardic event going on. Now, the Q wave, is there any pathological Q waves? When you scan for it in lead 1, no. Lead 2, no. Lead 3. In lead 3, is there meant to be a Q, or what about the S wave? When you remember when we spoke about lead 3 was coming from the left arm to the left leg. It was going from a negative to positive. So again, it was following the same direction as the heart, and it should look almost similar to lead 2. Here you can see there is a greater deflection in the Q wave in the lead 3, which should not be the case. So it's safe to say there is some sort of pathological Q wave, but at the same time there isn't. So now when we speak about normal variants tomorrow, you'll learn more about it. The ST segment. The ST segment is always best to look for in the precordial leads. Here you can always clearly see in V1, remember V1 and V2 looks at the right ventricle, whereas V5 and V6 looked at the left ventricle. Now when you look at the right ventricle, you can clearly see that there is some sort of depression in the ST segment. So here, remember the V1 and V2, there was a R wave and then a big negative S wave because the left ventricle took over and the compulsive, and you can see that from the isoelectric line there is a depression, so it's more depressed downwards. In V5 and V6 again you can see a Q and then an R wave and then a huge depression in the ST segment, Q, R wave and a huge depression. So there is clearly evidence of ST segment depression. There is no elevation in this case. What about a T wave? Is there an inverted T wave? There is. Look, if you look at remember from the rule in VR, previously we know that in VR and V1 the T waves are usually inverted, but in all the others they are usually normal. Here, do you see any inverted T waves? No. In V6, no. In V7, V3, no. V2, no. So therefore there are no inverted T waves, so there is no. So it's safe to say this person is probably suffering from some sort of ST. So the biggest elephant in this ECG is some sort of ST depressions between leads V2 to V6, and maybe suffering from some sort of angina attack or some myocardial ischemia, which requires intermediate emergency department intervention. Now let's look at another ECG. So we have, again, we start off with the same procedure. We look at leads. You look at all the different leads. You try to look away from the ECG. Do you see any abnormalities? So in V4, V5, V6, you see inverted T waves straight away. From far away you can clearly see it. You can see normally an inverted T wave was only meant to be present in VR and V1. You somehow seem to see it in V2 and V3 as well. What about in leads 1? Yes, normal. Leads 2. Okay, so let's start off by clarifying the rate. How many boxes do we have here? We have nearly one whole box, 2, 3, 4, 4.5, 5. So this person has a normal heart rhythm, nearly around 70. With this, what is the rhythm like? The rhythm is 1, 2, 3, 4, 4.5, 5. It's fairly constant. Feels like half plus 1.5, 2, 2.5, 3, 3.5, 4. Yep, you can safe to say this person has a regular rhythm. It's a sinus rhythm because you can see a P wave preceding every QRS complex in all the different segmented leads. What about the width of the QRS? It's roughly 3 boxes, so it's normal. Is there any pathological Q waves? No. Why is the S wave more negative in the third lead? We'll come to that in just a second. Everything else seems to be normal. Is there a pathological Q wave? No, there is no pathological Q wave. What about the ST segment? Look, mainly when I talk about ST segment, remember you always look for the ST precordial chest lead. Sorry, is there any? Can you identify the ST segment? No, it seems normal. Normal isoelectric line. Is there any depression? No. But what about the T wave? Now this is the big thing here. The T wave is clearly inverted in this case. So when the T wave was inverted, remember we said that the patient could be suffering from some sort of ischemia or ventricular hypertrophy. Finally, last one is, do you see any difference? What do you see on the ECG? So let's start off by looking at the leads 1 to AVR and AVL on the right, and then we'll come to the chest leads. So from far itself, you can see some sort of ST elevation in V1 to V5, right? So this person is clearly suffering from some sort of STEMI, i.e. some sort of myocardial infarction or unstable angina. Now, what about leads 1? Does the person have a regular heart rhythm? What is the heart rate like? The heart rate can be measured by 1, 2, 3, 3.5 boxes, which means clearly this patient is tachycardic. You can also confirm this by looking at the number of Qrs Complex. 1, nearly 2 boxes, it should be 3, so this person is tachycardic. Does this person have a sinus rhythm? Yes, there is a P wave preceding everything. Is there any pathological Q waves representing old myocardial infarction? No, not really. VR is negative, yes. So the main elephant in the room is in the chest leads, so V1 to V5. So clearly you can see an ST elevation. So ST elevation here, V1. Remember V1 was opposite. There was a big S wave in both V1 and V2. Clearly you can see an ST elevation. STV in V4 as well, you can see an ST elevation. So it's clearly evident that this person has myocardial infarction. So thank you for watching this video, and stay tuned for the next few videos. Hopefully you learned something from these ECG basics. The point of these last few examples was so that you just are able to recognize some normal things on an ECG.